Well, we're back on the record this morning, continuing the second part of our three-part series on the rise of drug overdoses in Southwest Michigan. On Friday, we talked about xylazine, a drug used for animals that's being added in some opioids. Today, we learn the science behind narcan, why it works, when it doesn't, as well as some extraordinary statistics.
Police often say to us that xylazine is mixed with fentanyl. And officers explain that narcan, doesn't always reverse those overdoses. Can you explain from a scientific point, though, why that is?
Narcan was engineered to reverse the effect of opiates, so fentanyl, morphine, and heroin, which is just a much more potent form of morphine. But xylazine is in its own class. It's just a sedative, works on different receptors. And so you may give the narcan and it'll reverse whatever effect is happening from an opiate, whether it's fentanyl, morphine, heroin. But the sedative effect of the xylazine will not be reversed. And so when people aren't waking up after the usual dose of narcan, they're instructed to give a second one because maybe there's a heavier dose than you suspect, and even a third one. If they're not waking up within several minutes, you need to be thinking of something else. So it's not it doesn't reverse xylazine because xylazine is not an opiate. Within the past few years, I think we have some numbers from the medical examiner. In 2019, there were 24 deaths from related to drug use, and in 2020 went up by over 40% to 34 deaths. Those are the last numbers that we have from our medical examiner. Thankfully, Narcan, folks are getting smart. Okay, fentanyl's out there. Narcan's now over the counter, which was a great move to hopefully alleviate, some of the hesitancy of trying to get this into the hands of those who are using and perhaps ashamed to try to find it, go to the police, go to the health department. So we're trying to find every way to get the Narcan into the hands of those who are using to try to avoid and blunt the effect of opiate overdoses.
We found in 2016, 8 Michigan County police departments used Narcan 44 times. By 2022, that number jumped to 162. A lot of lives saved because of this. So what do you attribute that to? And what do you hear from people who have seen their lives changed because of using Narcan?
When you encounter police, that could be a life-changing encounter. And when you wake up and there's policemen over you who've given you the Narcan, it's a second chance, and that will compel some of these folks, not all unfortunately, some of these folks to try to get some help finally. But unfortunately, there's still barriers to where do I go for help? Who knows what the agencies are that can help me? Do they even have the capacity to help me? So there's that second chance aspect that I think can help people move towards recovery, move towards help. But unfortunately, if you haven't hit rock bottom yet, sometimes you'll hit rock bottom when no one's around to save you, and that also happens. I mean, we've got numbers that from the medical examiner that 90% of drug overdoses happened with individuals who are using just by themselves, who are all alone. No one was there to recognize the overdose, or half of by the time EMS responds, half of them will already have been dead and can't be resuscitated. So those are huge numbers. There's things that we can do there, and we are trying to do through our prevention and education in that population. But we're really behind the curve as a society.
Well, of course, the big question now is how do we turn these numbers around? Tomorrow, Dr. Kabaltiga answers that question. And again, you're going to learn some surprising statistics along the way when we go back on the record.